Bismillahirrahmanirrahim. To study the surmountable antagonism between acetylcholine and atropine, so this is the normal contraction, and after normal contraction, first we will give the agonist. The agonist will stimulate the muscarinic receptor and it will produce approximately 50% of response. Now we are taking the agonist drug, which is from -5 and the dose is 0.2 ml. Now we are giving the acetylcholine 0.2 ml. Acetylcholine stimulates the muscarinic receptor and it produces the maximum response, mean it increase the contraction. So this is the effect of the agonist. After the contraction, after the effect of the agonist, now we have wash out the drug, mean the solution along with drug, and we supplying the fresh nutrients from the nutrients reservoir bottle. We will repeat this procedure 2 to 3 times. After wash out the drug, again there will be normal contraction. This is the normal contraction, 0.2 ml of acetylcholine agonist, which produce 50% of maximum response, and then we wash out the drug and this is the normal contraction. Again there is normal contraction. Here first we give the agonist, which is acetylcholine. Then we wash out the drug and repeated the procedure 2 to 3 times. Then again normal contraction. Here we will give the antagonist. Here we will give the antagonist, which is atropine. Now we are taking 0.4 ml of atropine. Now we are giving the antagonist atropine in the inner organ bath. this antagonist attached to the muscarinic receptor, showing their effect. Atropine showing their effect. And the dose of atropine is 0.4 ml. The dose is 0.4 ml into 10 raised to power minus 5. Remember, this 0.4 ml is equal to 4 microgram. 0.4 ml equal to 4 microgram, and here the 0.2 ml is equal to 2 microgram. This is the effect of the antagonist. In the presence of the antagonist, we will give the agonist. Now we are giving the agonist. Here the agonist, which is acetylcholine, shows some effect in the presence of antagonist, but this effect is less as compared to the first one, and the dose of this agonist acetylcholine is 0.8 ml, and it shows less contraction as compared to the first one, which is 0.2 ml into 10 raised to power minus 5. It produces maximum response, 50% maximum response, the agonist, because there is no antagonist. But here in the presence of antagonist, the antagonist shows some effect, then we give the agonist, which is 0.8 ml. This effect is more as compared to the 0.8 ml, because in the presence of the antagonist, the agonist shows some effects, mean that the receptor is partially blocked. Now we washed out both the drugs. Here we wash out both the drugs, acetylcholine and also atropine. Now again we are giving the agonist on the normal contraction. So the agonist again stimulates the muscarinic receptor, because there is no antagonist present here. Therefore the agonist showing more contraction. Now summary of this practical is: First, there is normal contraction. Then we give less dose, which is 0.2 ml of acetylcholine, and it produce maximum response. Then we wash out the drug. Again there is normal contraction. Then here we give 0.4 ml of antagonist. This is the effect of the antagonist. Normal activity. Atropine is used here as a antagonist. And this is the effect of the atropine. Atropine bind to the muscarinic receptor. Again we give agonist, which is acetylcholine, and the dose is 0.8 ml. It show less contraction in the presence of the antagonist. The dose here is large, 0.8 ml, but the receptor is partially blocked. Then we wash out both the drug. Again there is normal contraction. Here we give again the agonist, which is acetylcholine. Again, first we give the agonist, which increase the contraction, 0.2 ml. Then we wash out the drug. Again the normal contraction. Then we give 0.4 ml of atropine, which is antagonist. The atropine will bind to the muscarinic receptor and showed their effect. Then we give the agonist, which is acetylcholine, and the dose is 0.8 ml, but it show less effect, less contraction. Less effect as compared to 0.2 ml of acetylcholine. The effect is less, mean that the receptor is partially blocked. Here the receptor is partially blocked. And this type of antagonist between the acetylcholine and atropine, which compete for the receptor, for the same receptor, is called competitive pharmacological antagonist. Because the antagonist block the muscarinic receptor and the agonist stimulate the receptor.